So hello friends, welcome to my new video. So today we are going to discuss about negative relative accommodation. This is the orthoptic series that I started where I will discuss with you all the test that is done in orthoptics, because orthoptics is very important as an optometrist and you should know all the tests properly, right? So the next video will be on positive relative accommodation. This video is for negative relative accommodation. Okay, so what is negative relative accommodation? So this negative relative accommodation, actually this test is actually used to see or used to check how much amount of accommodation can be relaxed. Okay, suppose you are having a patient in your clinic, the patient is complaining of eye strain or headache after a short time of reading, or complaining of floating or moving words, that is indicating accommodative excess. Or the patient is usually complaining of blurring near vision with asthenopic symptom, it can be due to accommodative insufficiency. So negative relative accommodation test is actually performed to see whether the patient is actually having accommodative excess or insufficiency. You can understand by performing this test. So to perform this test, we actually need plus lenses, and before putting plus lenses, give the patient best corrective glasses. After that, proceed further. Okay, after the patient was given best corrective glasses, put the trial frame and do this procedure binocularly, where you will add plus lenses in 0.50 diopter steps, and instruct the patient to see the near target. Okay, you need to give the patient a near target at 40 centimeter and instruct the patient to see the near target, and when you will place plus lenses in front of the patient eye, the patient will move to myopic and the objects that near target will be appear blurry. So you need to instruct the patient to inform you, or you need to instruct the patient to try to make the blurry near target clear. Okay, and you are continuously increasing the positive lens power in 0.50 diopter steps, and at a stage or at a point will come where the patient will be not able to clear the near target clearly. Okay, so when you will put the plus lenses in front of the patient eye, the focus will be move forward. Okay, so that's why if the patient want to clear the near target, he need to relax his accommodation to see the near target clearly, right? So at a specific point where the patient is not able to clear that near target properly, that is known as first sustained blur. Okay, and so what is the meaning of that first sustained blur? That the near target is appearing blurry, and by relaxing the accommodation also the patient not able to clear the near target. So that is known as first sustained blur, and normal value in this test is plus 2.50 diopter. Now if during the test the patient, you found that the first sustained blur was at about uh, plus 3 or plus 3.5, it is indicating that the patient is actually having accommodative lag. And if the first sustained blur is before plus 2.5, like it is 1.5 or 1.75 or 1, it means the patient is actually having accommodative excess. So this is how you can understand whether the patient is actually having accommodative excess or accommodative lag. Thank you so much.